Ghana is so old, yet we are still having this conversation of no beds. Now, this conversation was more intensified after a young engineer lost his life after he was turned down by 3 different hospitals because they didn't have beds to accommodate him. Now, the board chairman for the Korle Bu Teaching Hospital, in a recent interview, spoke about the whole centralized system that is being put in place. Now, this is to confirm what the Minister of Health said a few days ago, that there's going to be a centralized system. Now, Mr. Titus Bayuo, who happens to be the board chairman for the Korle Bu Teaching Hospital, confirmed that they've already done a bed count with categorizations of the beds in his hospitals and other hospitals in Accra as well. And they are proceeding to the stage where each bed will have a barcode.
We are going to barcode these beds. And we now are developing an integrated bed management system.
Okay.
That will be associated with a national emergency response center.
So how the system is going to be is that when an ambulance picks up a patient, they have a tablet that gives them information on beds available in particular hospitals around them, so that they all don't take patients to the same hospital that is congested. Now, to the issue of Korle Bu Teaching Hospital usually being the first point of call for most emergency cases, he explained that it is because Korle Bu is more accessible to a lot of people, unlike hospitals like UGMC that do not accept the NHIS card.
If you look at all these other hospitals you've mentioned, the UGMC, the Bank Hospital, and the rest, the finance is a bit of a barrier to access. But Korle Bu is there for everybody. Korle Bu's capacity as of today is unsurpassed by all of these facilities. And
so Korle Bu is the biggest hospital in Ghana still?
In Ghana. In fact, in West Africa, it is about the 3rd biggest.
Serious?
Yes.
He also made mention of the fact that Ghana has an emergency care policy that was established in the year 2011.
There's a policy on emergency care that was released by the ministry in 2011. That policy, for instance, mandates that within 48 hours of any accident and emergency, we should provide care for everybody without recourse to the ability to pay.
But this policy has been poorly implemented. Now, with this policy, if a patient is brought to a medical institution under an emergency case, the patient is supposed to be treated in 48 hours. However, this is not even being taken into consideration. Now, he is saying that to strictly enforce this, a law must be put in place with punishment for people who do not follow this. Now, some schools of thought are also saying that the case may not be that Ghana needs a centralized system for beds, but rather there may not be enough beds. The ratio of beds to patients is 0.9 beds to 1,000 people. But the standard of the World Health Organization is that there are supposed to be 5 beds to 1,000 people. What are your thoughts on this? Do you think the case is that there are not enough beds in the country to support the number of people that require healthcare, or you think a centralized system can solve the whole issue? Let's have a conversation in the comment section. This is the lowdown on the Ghana Insider.